we implemented CGP with HRD now already a couple of years ago. So we started with CGP, added HRD when it was available. We were part also for the HRD harmonization study where we tested that extensively. And the benefit for the patient, it's incredible because you have much more information about mutations which can be addressed by therapy. You get incidental findings like variants which you did not expect. So, for example, translocation information. We had this patient with an HER2 translocation which had a benefit of the treatment, and this patient is now under treatment for around 3 years, according to the findings which we had with the CGP assay. And this is something what it's getting more and more important in the molecular tumor board. So we are doing this regularly, the testing with CGP assays, including translocation and HRD, and we find for a different set of patients now information also regarding HRD positivity. So we have more and more requests to do a CGP assay and lesser amount of smaller gene panels because the information amount is getting more and more relevant for the patient. And it provides also the oncologist the option to plan in the future. So if you have one treatment finished, then you can directly go to the next treatment option because you have the information about another gene which is mutated and the patient have a benefit of this. This testing is really important because we find HRD positive cases in different entities. So in sarcomas, we find it sometimes in pancreatic cancer. So we had a study about pancreatic cancer patients. So we included more than 200 patients with pancreatic cancer, did the HRD testing. We find on one side BRCA mutations, on the other side we find HRD positive cases without BRCA mutations. And again, we find here also translocations which might be addressable by therapy. So, and this makes it more and more important to include also HRD testing in your routine diagnostics. In-house reporting is very relevant because you can do it very fast. So you have the clinician at next door, so you can ask him or he can ask you what do you recommend. Then you're doing a CGP assay, get the information, provide that very fast to the clinician. He can ask you every time regarding what is the outcome. So what did you find? What does that mean for the patient? And this is why we are very happy to have it in-house. So, and we are not, it's not necessary to send it away. So sending away always means it takes time until it's there. Then they have to test it, and then they have to send the results back. And if you are doing it in-house, you have all at once.